Question 1. Which of the following methods is considered the most effective and humane technique for handling and restraining a dog that is exhibiting fearful behavior during a routine veterinary examination? A. Using a muzzle and physical force to limit movement. B. Employing positive reinforcement methods, such as food rewards and calming gestures. C. Isolating the dog in a dark room to calm it down before the examination. D. Forcing the dog into a restraint device for quick examination. Answer: B. Employing positive reinforcement methods, such as food rewards and calming gestures. Explanation: in animal care, especially when dealing with fearful animals, positive reinforcement methods are the most effective approach for handling and restraining animals. Positive reinforcement involves rewarding desirable behavior, e.g., calmness, cooperation with treats or praise. This method helps reduce the animal's stress and builds trust between the handler and the animal, especially during stressful events like veterinary examinations. Humane methods ensure animal welfare by preventing fear or injury, which is critical under the Animal Welfare Act and ethical standards in animal care practices. Methods such as using a muzzle or physical force, options A and D, may cause further stress or harm to the animal, making them less desirable. Isolating the dog in a dark room, option C, may be counterproductive as it doesn't address the root cause of the fear and may cause further distress. Question 2. Which of the following is the primary concern when managing the welfare of an animal during transport, especially for long-distance travel? A. Ensuring the animal is transported in a vehicle with adequate ventilation and temperature control. B. Making sure the animal is placed in a cage that is large enough to allow free movement. C. Allowing the animal to roam freely inside the transport vehicle to reduce stress. D. Ensuring that the animal is sedated during the entire transport process for calmness. Answer: A. Ensuring the animal is transported in a vehicle with adequate ventilation and temperature control. Explanation: when transporting animals, particularly over long distances, the welfare of the animal should be a primary concern. Adequate ventilation and temperature control in the transport vehicle are crucial to prevent distress or heat stroke, which could cause serious health issues. Transport regulations under the Animal Welfare Transport Act require that animals be kept in safe, comfortable environments to minimize stress during transit. Option B is important, but it is secondary to ensuring environmental controls like ventilation and temperature. Option C is unsafe and could result in injury or stress. Option D, involving sedation, is not recommended for most transport situations as it may mask distress and complicate the animal's ability to react to emergencies during travel. Proper welfare practices involve monitoring and ensuring the animal's environment remains within suitable conditions for its well-being. Question 3, scenario-based. Mr. Smith, a veterinarian assistant at a local animal shelter, has been asked to prepare a new intake animal dog that has just been rescued from an abusive situation. The dog shows signs of severe stress, including panting, trembling, and growling. Mr. Smith is aware of the importance of animal welfare and the need for gentle approach to prevent worsening the dog's condition. What is the most appropriate course of action? Mr. Smith to take: A. Immediately attempt to restrain the dog to stop it from moving around and causing harm. B. Use tranquilizer to sedate the dog so that it can be handled safely without distress. C. Give the dog some time to adjust to its new environment before attempting any handling or examination. D. Place the dog in small, confined area and force it to interact with the staff to overcome its fear. Answer: C. Give the dog some time to adjust to its new environment before attempting any handling or examination. Explanation: in the case of an animal that is showing signs of severe stress, particularly following abuse or neglect, it is essential to allow the animal time to adjust to its new environment before attempting to handle or examine it. This minimizes the risk of further traumatizing the animal and is consistent with the principles of animal welfare. Post-handling options and D could exacerbate the dog's fear and potentially lead to aggressive behavior or physical injury, while tranquilizing, option B, may be an option in certain circumstances. It is typically reserved for situations where the animal is in extreme distress and other methods have failed. Allowing the animal to acclimate to its surroundings promotes trust building and reduces anxiety, which is aligned with industry standards for animal care as emphasized in ethical animal welfare guidelines. Question 4. Which of the following is the most important factor to consider when designing an animal housing facility for dogs in a shelter environment to ensure their health and welfare. A. The size of the individual dog housing units should be as large as possible to allow for maximum freedom of movement. B. The facility should include plenty of natural light to provide a more comfortable environment for the dogs. C. The housing should be designed to accommodate the dog's individual needs with attention to temperature, ventilation, and cleanliness. D. The facility should prioritize the aesthetic appeal of the environment to ensure an atmosphere for visitors. Answer C. The housing should be designed to accommodate the dog's individual needs with attention to temperature, ventilation, and cleanliness. Explanation: the primary consideration when designing an animal housing facility is the health and welfare of the animals, which requires providing an environment that meets their individual needs. Ensuring that the housing is well ventilated, appropriately heated or cooled, and regularly cleaned is critical to preventing the disease and ensuring the dog's overall well-being. While size, option A, is important, it should not compromise other factors like temperature or cleanliness. Natural light, option B, can improve comfort but is secondary to the basic needs of the animals. Aesthetic appeal, option D, is not priority in animal care and should not take precedence over factors that contribute to the animal's physical and mental health. Question 5. In the event that an animal co-worker is exposed to a zoonotic disease, which of the following actions is considered the most appropriate according to workplace health and safety protocols? A. Immediately notify the employer and follow the prescribed safety protocols for exposure to zoonotic diseases. B. Continue working with animals, but wear additional protective gear to minimize the risk of further exposure. C. Ignore the exposure if no immediate symptoms are present, as the risk of infection is minimal. D. Leave the workplace immediately without informing anyone, as the worker should not risk further exposure. Answer: A. Immediately notify the employer and follow the prescribed safety protocols for exposure to zoonotic diseases. Explanation: in any situation where an animal care worker is exposed to a zoonotic disease, a disease that can be transmitted from animals to humans, the appropriate action is to immediately notify the employer and follow established safety protocols. These protocols are designed to minimize the risk of disease transmission, proper medical care, and protect other staff members and animals. Continuing to work, option B, or ignoring the exposure, option C, is dangerous and goes against workplace safety regulations. Leaving the workplace without informing anyone, option D, does not address the health risks and would fail to comply with necessary workplace health and safety procedures as outlined by the relevant workplace safety regulations and guidelines. Question 6. Which of the following signs would indicate a potential injury or illness in a cat that requires immediate attention from a veterinarian? A. A decrease in appetite and slight lethargy after a change in diet. B. Sudden loss of balance, difficulty standing and disorientation. C. Mild coughing during a play session. D. A slight increase in body temperature after a vaccination. Answer: B. Sudden loss of balance, difficulty standing and disorientation. Explanation: a sudden loss of balance, difficulty standing and disorientation in a cat could indicate a neurological issue or injury that requires immediate veterinary attention. These symptoms may point to conditions such as a stroke, severe head trauma, or an underlying health condition that requires urgent medical intervention. The other options, the CD, describe symptoms that might be less serious or normal responses under certain circumstances. Decreased appetite and lethargy, option A, may occur due to changes in diet but aren't as urgent unless prolonged. Mild coughing, option C, can be common during play and is not necessarily indicative of a serious problem. An increase in temperature post-vaccination, option D, is typical and should not cause alarm unless it persists or is accompanied by other symptoms. Question 7. Which of the following procedures is part of the standard sanitation protocol in an animal care facility to prevent the spread of infectious diseases? A. Regular disinfection of animal housing areas with an appropriate disinfectant. B. Only cleaning areas where the animals have direct contact. C. Using the same cleaning tools for all areas in the facility to save time. D. Sanitizing animal food and water bowls once a week. Answer: A. Regular disinfection of animal housing areas with an appropriate disinfectant. Explanation: regular disinfection of animal housing areas with appropriate disinfectants is crucial for preventing the spread of infectious diseases. Facilities that care for animals must implement strict sanitation protocols to maintain a hygienic environment. These protocols typically include regular cleaning and disinfection of surfaces, cages, equipment, or areas the animals come into contact with. Option B is incorrect because all areas of the facility, not just those with direct animal contact, need regular cleaning. Using the same cleaning tools for all areas, option C, can result in cross-contamination. Sanitizing food and water bowls only once a week, option D, is insufficient as these items should be cleaned daily to maintain optimal hygiene standards. Question 8. Which of the following is an essential component of a first aid kit used in animal care to address minor wounds and injuries? A. Animal-specific pain relief medication. B. Sterile gauze pads for wound dressing and bandaging. C. Sedatives to calm the animal during an injury. D. A wide selection of over-the-counter antibiotics for general use. Answer: B. Sterile gauze pads for wound dressing and bandaging. Explanation: sterile gauze pads are a critical component of any first aid kit in animal care. They are used to dress and bandage wounds to stop bleeding and prevent infection. These items are necessary for handling minor injuries or cuts and are essential for ensuring that wounds are treated hygienically, while pain relief, option A, and sedatives, option C, may be required in situations. They should only be administered under veterinary guidance. Over-the-counter antibiotics, option D, should not be used indiscriminately as they may not be appropriate for all types of infections and could lead to antibiotic resistance. Question 9. What is the primary objective of implementing enrichment activities for animals in an animal care facility? A. To keep the animals entertained and distracted from their confinement. B. To provide mental stimulation and promote natural behaviors. C. To prevent animals from becoming overly social with each other. D. To increase the animal's physical size and strength over time. Correct answer: B. To provide mental stimulation and promote natural behaviors. Explanation: the primary goal of enrichment activities is to provide mental stimulation and encourage natural behaviors, which are vital for the overall well-being of animals in captivity. Enrichment helps reduce stress, boredom, and abnormal behaviors by giving animals opportunities to engage in activities that mimic their natural environment. While entertainment can be a byproduct, it is not the primary goal. Preventing socialization, option C, is counterproductive as appropriate socialization is crucial for many species. Increasing physical size and strength, option D, is unrelated to the purpose of enrichment, which is focused on mental and emotional well-being. Question 10. Which of the following is a key factor in preventing stress-related behaviors in cats during a routine grooming session? A. Using quick and forceful motions to complete the grooming as quickly as possible. B. Ensuring a calm and quiet environment with plenty of time for breaks if needed. C. Grooming the cat only once every few months to minimize disruption to its routine. D. Playing loud music during the grooming session to mask any potential noises. Answer: B. Ensuring a calm and quiet environment with plenty of time for breaks if needed. Explanation: creating a calm and quiet environment is essential for preventing stress during grooming sessions. Cats, like many animals, can become easily stressed by loud noises or abrupt movements. Allowing plenty of time for breaks gives the cat a chance to adjust and relax between grooming steps. Quick and forceful motions, option A, increase likelihood of stress and injury. Grooming infrequently, option C, is not ideal. Regular grooming helps prevent mats and health issues. Playing loud music, option D, could exacerbate stress rather than relieve it, as cats are sensitive to sound. Question 11. When introducing a new animal to an existing group in an animal care facility, which of the following strategies is most effective in reducing aggression and stress? A. Immediately allowing the new animal to interact with the existing group without any separation. B. Introducing the new animal gradually using a barrier or separate space and monitoring their interactions. C. Keeping the new animal completely isolated from the group for a long period. D. Forcing the animals to interact quickly to minimize any potential conflict. Answer: B. Introducing the new animal gradually using a barrier or separate space and monitoring their interactions. Explanation: the most effective method for introducing a new animal to an existing group is gradual introduction, allowing the animals to acclimate to each other's scent and presence through a barrier or separate space. This helps reduce aggression and stress, as animals can observe each other and adjust to the new social dynamics without immediate physical contact. Immediate interaction, option A, may lead to stress or aggression, and isolation, option C, for too long can result in the new animal feeling neglected or anxious. Forcing interactions, option D, is likely to result in stress or potential harm to the animals. Question 12. Which of the following practices is essential for preventing the spread of parasites in an animal care facility? A. Regular veterinary checkups and treatment for all animals in the facility. B. Allowing animals to interact freely with one another without restriction. C. Using the same bedding for all animals to reduce costs. D. Limiting access to fresh water to prevent parasite contamination. Answer A. Regular veterinary checkups and treatment for all animals in the facility. Explanation. Regular veterinary checkups are critical for detecting and treating parasites before they spread to other animals. Routine treatments such as deworming help ensure that parasites are managed effectively. Allowing free interaction, option B, without proper parasite control measures can lead to the transmission of parasites. Using the same bedding, option without sanitization can also facilitate the spread of parasites. Limiting fresh water, option D, is not an effective method for parasite control and can lead to dehydration or malnutrition, which would worsen the animal's health. Question 13. What is the primary goal of a behavior modification plan for an animal showing aggressive behavior in an animal care facility? A. To completely eliminate all forms of aggression regardless of the situation. B. To identify triggers for aggression and gradually reduce the intensity of the behavior. C. To punish the animal for aggressive actions in order to stop the behavior. D. To isolate the animal from others permanently to prevent any aggressive incidents. Answer B. To identify triggers for aggression and gradually reduce the intensity of the behavior. Explanation. The goal of a behavior modification plan is to identify the specific triggers that lead to aggressive behavior and gradually work to reduce the intensity of that behavior through positive reinforcement and other techniques. Punishing the animal, option C, is ineffective and can exacerbate aggression, leading to more stress. Isolating the animal, option D, without addressing the underlying issues, only provides a temporary solution and does not address the root causes of the aggression. A complete elimination of aggression, option A, may not always be realistic or appropriate, as some aggressive behaviors are natural responses in certain situations. Question 14. Which of the following should be considered when designing an enrichment program for small rodents in an animal care facility? A. Providing only food-related enrichment activities to encourage eating. B. Offering a variety of items such as tunnels, climbing structures, and safe chew toys to encourage natural behaviors. C. Limiting enrichment activities to once per week to prevent overstimulation. D. Avoiding any enrichment that mimics natural environments to prevent stress. Answer B. Offering a variety of items such as tunnels, climbing structures, and safe chew toys to encourage natural behaviors. Explanation. Providing a variety of enrichment items such as tunnels, climbing structures, and safe chew toys is essential for encouraging the small rodents' natural behaviors such as exploring, foraging, and chewing. These activities promote physical and mental stimulation and help reduce stress and boredom. Food-related enrichment alone, option A, is insufficient as it does not engage the animals in other important behaviors. Limiting enrichment to once per week, option C, is inadequate as regular enrichment is necessary to maintain the animal's well-being. Avoiding enrichment that mimics natural environments, option D, can lead to stress as animals need opportunities to express natural behaviors to thrive. Question 15. Which of the following is the best way to prevent the risk of disease transmission between animals in a care facility? A. Restricting animal movement and interaction between different species in the facility. B. Allowing animals to interact with as many other animals as possible to build immunity. C. Providing a communal living space for all animals to promote socialization. D. Avoiding any medical treatments or vaccinations unless absolutely necessary. Answer A. Restricting animal movement and interaction between different species in the facility. Explanation. Restricting animal movement and limiting interaction between different species are essential practices in preventing the spread of diseases, particularly zoonotic diseases that can be transmitted between species. It is important to maintain biosecurity by keeping different species or animals with unknown health statuses separate to reduce the cross-species contamination. Allowing widespread interaction, option B, or communal living spaces, option C, increases the risk of disease transmission. Avoiding necessary medical treatments or vaccinations, option D, can leave animals vulnerable to infections that could spread within the facility. Question 16. Which of the following is the most important factor when determining the appropriate diet for an animal in your care? A. The animal's age, breed, and size. B. The animal's preferred food based on observation. C. The availability and cost of food. D. The animal's previous eating habits, regardless of its current health condition. Answer A. The animal's age, breed, and size. Explanation. When determining the appropriate diet for an animal, it is crucial to consider the animal's age, breed, and size, as these factors directly influence its nutritional needs. For example, puppies or kittens have different dietary requirements compared to adults or seniors, and certain breeds may have predispositions to specific health conditions that can be managed through diet. While observation, option B. Eating preferences is helpful, it should not be the primary factor if the animal's health needs differ. The cost or availability of food, option C, should not compromise the nutritional needs of the animal. Similarly, previous eating habits, option D, are not as important as addressing the current health status and nutritional requirements. Question 17. Mr. Harris works in an animal care facility and notices a dog showing signs of extreme fear, such as excessive trembling, hiding, and avoidance behaviors. Which of the following actions should Mr. Harris take first to manage the situation effectively? A. Immediately remove the dog from the facility to avoid further stress. B. Force the dog into interactions with people to desensitize it to fear. C. Provide a calm, safe space and avoid forcing any interactions until the dog calms down. D. Scold the dog for its fearful behavior to discourage it. Answer C. Provide a calm, safe space and avoid forcing any interactions until the dog calms down. Explanation. In this scenario, the best action is to provide the dog with a calm and safe space where it can retreat and feel secure. Avoiding forced interactions is critical to prevent further stress or anxiety. Fearful behavior is a sign that the animal is overwhelmed, and pushing the dog into social situations, option B, or removing it from the facility, option A, may not address the root cause of the anxiety. Scolding the dog, option D, will likely exacerbate the fear, as punishment does not address the emotional state of the animal. A calm approach allows the animal to adjust and recover, helping it feel safer and more confident. Question 18. Which of the following actions should be taken to ensure the proper hygiene and cleanliness of animal enclosures in a care facility? A. Clean enclosures only once per month to prevent disturbing the animal's environment. B. Use the same cleaning supplies for all animal enclosures to save costs. C. Follow regular cleaning schedule and use species-appropriate cleaning agents to ensure sanitation. D. Avoid using any cleaning agents that may have scent, as they can stress animals. Answer C. Follow regular cleaning schedule and use species-appropriate cleaning agents to ensure sanitation. Explanation. Regular cleaning of animal enclosures is critical to prevent the buildup of waste, pathogens, and parasites that can cause illness. A consistent cleaning schedule ensures that enclosures remain hygienic. It is also important to use species-appropriate cleaning agents, option C, as different species may be sensitive to chemicals or scents. Using the same cleaning supplies for all enclosures, option B, may lead to cross-contamination or inappropriate chemical use. Cleaning only once a month, option A, is not sufficient, as it increases the risk of hygiene issues. Avoiding all cleaning agents with scents, option D, is not always necessary if the proper animal-safe cleaners are used. Question 19. In an animal care facility, which of the following is the most effective strategy to manage and reduce the risk of zoonotic diseases? A. Ensuring all staff members have completed training on zoonotic disease prevention and hygiene practices. B. Allowing staff to handle animals without gloves to increase familiarity and comfort. C. Encouraging animals to interact with the public to build their immunity to diseases. D. Cleaning animal enclosures only when animals are removed, avoiding unnecessary stress on the animals. Answer A. Ensuring all staff members have completed training on zoonotic disease prevention and hygiene practices. Explanation. The most effective strategy for preventing zoonotic diseases in an animal care facility is comprehensive training for all staff on proper hygiene practices, the handling of animals, and recognizing potential symptoms of zoonotic diseases. Proper hand washing, glove usage, and sanitation protocols significantly reduce risk of transmission. Allowing staff to handle animals without gloves, option B, increases the risk of contamination. Encouraging unnecessary interactions with the public, option C, can expose animals to potential sources of infection. Cleaning only when animals are removed, option D, may lead to inconsistent hygiene practices and unnecessarily increase the risk of contamination. Question 20. What is the primary purpose of animal behavior training in an animal care facility? A. To ensure animals are obedient and follow commands at all times. B. To provide animals with an opportunity for enrichment and socialization while reducing stress. C. To prepare animals for adoption by forcing them to adapt to new environments. D. To correct bad behavior through punishment and forceful training methods. Answer: B. To provide animals with an opportunity for enrichment and socialization while reducing stress. Explanation: the primary purpose of animal behavior training is to provide enrichment and improve socialization. Well-structured training helps animals learn appropriate behaviors, reducing stress and anxiety and promoting overall well-being. It also encourages positive interaction with humans and other animals, which can improve the animal's rep. For adoption or integration into a care facility, simply focusing on obedience, option A, is too narrow, as training should also address the emotional and behavioral needs of the animal. Forcing adaptation to new environments, option C, or using punishment, option D, are ineffective and harmful training methods that can exacerbate stress or aggressive behavior. Question 21. Which of the following should be the first priority when performing a health assessment on a newly admitted animal? A. Determine the animal's weight and age. B. Check the animal's vital signs to assess its immediate health status. C. Perform full-body grooming session to improve the animal's comfort. D. Feed the animal to ensure it is well nourished. Answer: B. Check the animal's vital signs to assess its immediate health status. Explanation: when performing a health assessment on a newly admitted animal, the immediate priority should be to check the animal's vital signs, including heart rate, respiration, and temperature. These signs provide essential information about the animal's overall health and can indicate whether there is any immediate need for medical attention. While determining the animal's weight, and option A, is important for further care planning, it should not take precedence over assessing the animal's current health. Grooming, option C, and feeding, option D, are necessary but secondary tasks that do not directly address the immediate health condition of the animal. Question 22. Which of the following is an essential consideration when designing an animal's living space in care facility? A. The cost of materials used to construct the enclosure. B. The size of the enclosure relative to the animal's species and activity level. C. The ease of access for facility staff only. D. The aesthetic appearance of the enclosure. Answer: B. The size of the enclosure relative to the animal's species and activity level. Explanation: the most important consideration when designing an animal's living space is the size of the enclosure relative to the animal's species, size, and activity level. Animals require enough space to move, freely exercise, and express natural behaviors, which are critical for their mental and physical health. While cost, option A, and aesthetic appearance, option D, are practical concerns, they should not compromise the welfare of the animal. Ease of access for staff, option C, is also important, but it should not take precedence over the animal's needs for space and enrichment. Question 23. Mr. Thompson is caring for a cat with an eye infection. He notices that the cat is becoming more agitated when he attempts to apply medication. What is the best approach to manage the situation while ensuring the cat receives proper treatment? A. Hold the cat down forcefully to apply the medication as it is necessary for its recovery. B. Avoid applying the medication until the cat is calm and comfortable and then attempt to apply it again slowly. C. Ask a colleague to take over the task, as Mr. Thompson should not handle the cat if it is stressed. D. Use a tranquilizer to sedate the cat so the medication can be applied without resistance. Answer: B. Avoid applying the medication until the cat is calm and comfortable, and then attempt to apply it again slowly. Explanation: it is essential to manage the cat's stress and anxiety in this situation to ensure its safety and comfort. Forcing the cat to accept medication, option A, can cause further stress, which may hinder its recovery. Asking colleague to handle the task, option C, is helpful in some cases, but may not always be necessary if the animal can be calmed effectively. Sedating the cat, option D, should be last resort, as unnecessary sedation can cause additional risks and discomfort. The most effective approach is to give the cat time to calm down, option B, and use positive reinforcement to apply the medication slowly and gently. Question 24. Which of the following best describes the primary concern when transporting animals in a care facility vehicle? A. Ensuring the animal has enough space to roam freely during transport. B. Ensuring the animal's safety, comfort, and welfare by securing them in appropriate enclosures or restraints. C. Reducing the cost of transport by using the smallest available vehicle. D. Ensuring that all animals are transported in single group to reduce the number of trips required. Answer B. Ensuring the animal's safety, comfort, and welfare by securing them in appropriate enclosures or restraints. Explanation: when transporting animals, the primary concern is their safety, comfort, and welfare. This can be achieved by using appropriate enclosures or restraints to prevent injury and stress during transit. Animals should never be allowed to roam freely in the vehicle. Option A, as this could lead to injury or increased anxiety. Cost considerations, option C, should not outweigh the animal's needs, and transporting animals in large groups, option D, can cause unnecessary stress and increase the risk of injury. Properly securing each animal in suitable space ensures safe and comfortable journey. Question 25. Which of the following is a crucial part of disease prevention and control in an animal care facility? A. Encouraging animals to interact with each other to build immunity. B. Regularly sanitizing animal living areas and equipment to reduce pathogen spread. C. Using the same feeding utensils for all animals to reduce waste. D. Ignoring the cleaning of enclosures if animals are healthy and not showing signs of illness. Answer B. Regularly sanitizing animal living areas and equipment to reduce pathogen spread. Explanation: regular sanitization of animal living areas and equipment is essential for preventing the spread of diseases in a care facility. Pathogens can spread quickly if surfaces and equipment are not regularly cleaned. Encouraging interaction between animals, option A, does not directly prevent disease and can increase the risk of transmission, especially of vaccinated or immunocompromised animals. Using the same feeding utensils, option C, can lead to cross-contamination between animals. Ignoring the cleaning of enclosures, option D, is a significant risk even when animals appear healthy, as many diseases can be asymptomatic in the early stages. Question 26. Which of the following is the most important factor to consider when choosing personal protective equipment, PPE, for handling a potentially aggressive animal? A. The aesthetic appeal of the PPE. B. The comfort and style of the PPE for the handler. C. The suitability of the PPE in protecting the handler from bites, scratches, or other injuries. D. The cost effectiveness of the PPE. Answer C. The suitability of the PPE in protecting the handler from bites, scratches, or other injuries. Explanation: when handling a potentially aggressive animal, the primary concern is the handler's safety. PPE should be chosen based on its ability to protect the handler from bites, scratches, or other injuries that may occur during the interaction, while the aesthetic appeal, option A, and comfort, option B, are important considerations. They should override the protective function of the equipment. Cost effectiveness, option D, is a consideration, but safety must always come first, especially in high-risk situations where an aggressive animal may cause harm. Question 27. Mr. Green is responsible for cleaning the animal enclosures at a shelter. After cleaning the area, he notices some leftover waste near the corners of the cage. What is the best course of action? A. Ignore the waste as it is in a hard-to-reach area. B. Use a more thorough cleaning method to remove the remaining waste. C. Leave the waste for later cleaning as it is not an immediate health risk. D. Disinfect the cage immediately without properly removing the waste. Answer B. Use a more thorough cleaning method to remove the remaining waste. Explanation: proper cleaning and hygiene protocols are crucial in preventing the spread of disease and maintaining animal health. If waste is left behind in hard-to-reach areas, option A, it can harbor pathogens that may pose a health risk to the animals. Ignoring the waste or leaving it for later, options C and D, increases the risk of contamination. A more thorough, option B, should be performed to ensure all waste is properly removed, preventing bacterial growth and maintaining a clean, safe environment for the animals. Question 28. Which of the following best describes the role of environmental enrichment for animals in care facilities? A. It is only necessary for animals that exhibit signs of stress or anxiety. B. It is used to increase the workload for animal care staff. C. It is designed to promote natural behaviors, reduce stress, and enhance overall well-being. D. It is primarily intended to keep the animals entertained during quiet periods. Answer C. It is designed to promote natural behaviors, reduce stress, and enhance overall well-being. Explanation: environmental enrichment is a critical aspect of animal welfare that helps to promote natural behaviors, reduce stress, and improve overall well-being. It is not just for animals showing signs of stress, option A, but for all animals, as it allows them to engage in species-specific activities such as foraging, exploring, socializing. It should not be seen as a way to increase the workload for staff, option B, or merely keep the animals entertained, option D. The purpose of environmental enrichment is to create a stimulating environment that mimics natural conditions and supports the animal's physical and mental health. Question 29. Which of the following should be done first when responding to a report of an animal injury in the facility? A. Administer pain relief medications to the injured animal. B. Assess the severity of the injury and provide immediate first aid if necessary. C. Report the injury to a veterinarian without performing any initial assessments. D. Remove the animal from the facility to an external medical center immediately. Answer: B. Assess the severity of the injury and provide immediate first aid if necessary. Explanation: when responding to an animal injury, the first step should always be to assess the severity of the injury and provide immediate first aid if necessary. Option B. This may include stopping any bleeding, immobilizing the injured area, or stabilizing the animal's condition before further medical attention is provided. Administering pain relief medications may be necessary in some cases, but should not be done before assessing the injury. Reporting the injury to veterinarian, option C, should follow an initial assessment to ensure that the appropriate care is provided. Removing the animal, option D, may be necessary, but only after the injury has been assessed and stabilized. Question 30. Which of the following actions would best help reduce the risk of zoonotic diseases in an animal care facility? A. Allowing animals to interact freely with staff and other animals without any restrictions. B. Implementing strict hygiene and sanitation protocols for both staff and animal living areas. C. Vaccinating only the animals that appear to be ill. D. Relying on a single disinfectant to clean all areas of the facility. Answer: B. Implementing strict hygiene and sanitation protocols for both staff and animal living areas. Explanation: reducing the risk of zoonotic diseases that can be transmitted from animals to humans, requires implementing strict hygiene and sanitation protocols. This includes regular cleaning and disinfection of animal living areas, equipment, and surfaces, as well as ensuring that staff follow proper hygiene practices such as hand washing and wearing appropriate PPE. Allowing animals to interact freely, option A, can increase the risk of disease transmission, particularly if the animals are not properly vaccinated or monitored. Vaccination, option C, is important, but it should be done for all animals as part of a comprehensive health program, not just those that appear ill. Relying on a single disinfectant, option D, may not be effective against all pathogens. A variety of cleaning agents may be necessary to reduce risk effectively.